Today we will talk about a technology that you know very well, that is the Cryptomphalus aspersa secretion. And we will talk about the cutaneous regeneration that is induced by this secretion after the laser procedures. Very briefly, I like to highlight that this is a patent technology from Cantabria Labs that is for advanced cutaneous regeneration against cutaneous aging. This is the secretion, SCA is the secretion from a mollusk that is called Cryptomphalus aspersa, that is rich in growth factors, protein, antioxidant, glycosaminoglycans, and the activity is to induce the regeneration of the dermal components and the extracellular matrix. The main mechanism of action that we can recognize in this secretion is the antioxidant and regenerative activity. And the mechanism of action specifically is inducing the keratinocyte migration, inducing the epidermal regeneration, and inducing the activation of the fibroblasts and inducing the proliferation of the fibroblasts, inducing in this way the dermal regeneration. And really this is a cosmetic product, but this technology have a very high scientific support. Regarding the mechanisms of action, we have many in vitro studies that support these activities, because we have studies that demonstrate the fibroblast proliferation and migration of the fibroblasts. We demonstrate in vitro how the SCA secretion is inducing a better morphology of the fibroblasts. In this study, for example, we can see perfectly that this is the young fibroblast cytoskeleton, but when you are working with photoaged fibroblasts, this is the cytoskeleton that is totally altered by the sun radiation. But when you use this culture of fibroblasts and you add the secretion of Cryptomphalus aspersa, you can see that the morphology of the fibroblast seems the young fibroblast, because it's regenerating the morphology of the fibroblasts. The Cryptomphalus aspersa secretion is inducing the assembly and the renewal of the extracellular matrix, that is the support of the skin, and is very important, and obviously have antioxidant activity to try to reduce the oxidative stress induced by environmental aggressors. Okay. Obviously, we have studies that demonstrate that the Cryptomphalus aspersa secretion we can demonstrate that there are studies that demonstrate the reduction of the wrinkles, the number of the wrinkles on the skin, and demonstrate the depth of the wrinkles and induce skin firmness. We have some of the clinical studies that we perform. In the first one with histology, we demonstrate by profilometry, confocal profilometry, and with histology, we demonstrate that SCA secretion after 3 months of treatment reduce the depth of the wrinkles, induce skin firmness, as you can see in this study, and even in the neck and decollete. We have some studies that demonstrate that the regeneration of the skin induced by the SCA after to perform procedures is very important. And we demonstrate previously in some studies where we perform chemical peels or we perform non-ablative fractional lasers. In all of these studies, we demonstrate that we can reduce the side effect related to the procedures, and we can enhance the regeneration the skin after the procedure. Okay, and I like to talk today about the last studies that we performed with SCA after procedures. One of the studies, above studies, has been published very recently in the journal Cosmetic Dermatology, and one of the study was performed after to perform non-ablative fractional laser, and the other was do it with ablative fractional CO2 laser. Okay, and the first study that was performing non-ablative fractional laser was performing 20 women with moderate skin aging. It's a double-blind, split-face study. In this case, we apply one ampoule of SCA secretion 40% immediately after to perform the non-ablative fractional laser, and then was applied twice a day, morning and night, during 1 week. Obviously, we use photoprotection during all time of the treatment. You know very well that the photoprotection is the #1 treatment for anti-aging treatment, no? And after that, we recommended between the session of non-ablative fractional lasers, continues using SCA 40%, but just once a day, okay? Until the second procedure with non-ablative fractional laser 3 weeks after the first session. The non-ablative fractional laser was performed with erbium glass, 1540 nanometers, and this is the parameter that we use in this study. And we can see the results. We know very well that the non-ablative fractional laser is inducing microcolumns on the skin, and we need to regenerate the microcolumns that because means that the regeneration of the skin is faster, or this regeneration induces that the skin is healthy. Okay, we saw the microcolumn density by dermoscopy, and this is a split face study, and in half of the face the patient applied vehicle, and in the other side they apply the active ingredient that is SCA 40%. And we can see the results, that is amazing differences just in 24 hours, because you can see the differences after 24 hours. This is the site treated with the vehicle, and we can see the microcolumns maybe, but in the site treated with the SCA secretion, we can see that the microcolumns start to disappear. And the difference is much more after 3 days and after 7 days. In all cases, the differences between the site treated with the vehicle and the site treated with the SCA secretion are very significant, okay? So we can see that the SCA is inducing the regeneration of the skin after non-ablative fractional laser, because the density of the microcolumns created by the laser decrease significantly faster in the site treated with SCA. There are another parameters, because we know very well that when you are altering the skin barrier function with this alteration, you are inducing an increase of the transepidermical water loss, okay? And in this case, we can see that after 24 hours, okay, after to perform the laser, the transepidermical water loss decreased significantly in the site treated with SCA. This is another differences that is inducing, that means that really increase the regeneration, and the regeneration in the site treated with the SCA is faster. Okay. Another evaluation that we perform in this study is the anti-aging parameters. And we can see that double of the participants, the double of the volunteers in the site treated with the SCA, they improve the elasticity and they show a reduction in the wrinkles area. Okay, that means that the site treated with the SCA is improving the anti-aging parameters like elasticity or wrinkles, are improving the results of the non-ablative fractional laser. Obviously, in both sides, we have good results with non-ablative fractional laser, but the site treated with the SCA was better. Okay. And this is the adverse effects that we can have with non-ablative fractional laser, that you know that the most important is the erythema. And in these cases, the burning sensation too is important. And in this case, we can see that the site treated with the SCA, the erythema disappears significantly faster when you compare with the site treated with the vehicle. And the burning sensation disappears faster than the site treated with the vehicle. Okay, reduce the adverse effects after to perform the placebo, to perform the treatment. Okay, and this is the second study. Okay, that I like to show it. This is very recently published in the journal Cosmetic Dermatology. This is a double-blind, split-phase study performed in 10 women with moderate to severe skin aging. In this study, obviously, we perform just one session of the laser, because we perform an ablative laser with core platform with CO2 fractional laser. And this is the parameters that we use it. And we apply immediately after the ablative procedure, we apply the SCA 40% over the skin. And we continue using twice a day during the 1 week after the procedure. And we continue to use it just once a day during 2 weeks more, okay, to try to see the results after 3 weeks of the treatment, okay. In these cases, as you know, that the ablative fractional laser or the CO2 induce a reduction of hydration of the skin, you can use or you can add a cream, in this case with a SCA secretion in low percentage, but is a cream to try to regenerate and hydrate the skin, okay? But the most important is SCA 40%, use it immediately after ablative CO2 laser, and using it twice a day during the 1 week after the procedures. This is the intensive treatment that we are recommended, because we obtain very good results. As you know, the CO2 fractional laser is inducing the microcolumns too, and we can see in the deep mode, that is much more, I like to highlight the microcolumns with deep mode. You can see the site treated with active and the site treated with the vehicle. After 3 days, after 72 hours, you can see very significant differences between the site treated with the active and the site treated with the vehicle. We obtain approximately 80% of the reduction, the differences between active and vehicle site after to treat it with a SCA secretion and in the reduction of the microcolumns microcolumns. Okay, the microcolumn density on the site treated with the SCA was exactly 83% greater than that on the hemiphase treated with the vehicle. This is amazing differences, and the differences we can see after 3 days and after 7 days. In this case, you can see that after 1 week to use it as SCA, Cryptomphalus aspersa secretion, we reduce completely the density of the microcolumn. Even you cannot see microcolumns. Look at this, but in the site treated with the vehicle, you can see the microcolumns. Okay, this is that means that is inducing an important and significant regeneration after to perform ablative fractional laser, in this case with CO2. Obviously, we measured the transepidermical water loss. Obviously, increase the transepidermical water loss increase very, very fast after to perform the procedures in both sides. But then, after 3 days of to perform the procedures, we can see the differences in the site treated with the active and the site treated with the vehicle. And we can see that is significant differences in both, with a reduction of the transepidermical water loss in the site treated with the active. And obviously the anti-aging parameters like elasticity, like wrinkles, improve obviously in both sides after to perform a CO2 laser, but we can obtain 50% greater improvement on the site treated with the Cryptomphalus aspersa secretion when you compare with the vehicle site at the end of the treatment. Obviously, the adverse effects, you know that after to perform one ablative fractional laser with CO2, we have erythema, tightness, edema, burning. Okay, all of these adverse effects was significantly reduced after 3 days in the site treated with SCA. Okay, that means that SCA secretion, the Cryptomphalus aspersa secretion, 40%, not just is inducing faster regeneration of the skin after the procedure, that means that is reducing the adverse effects induced by the procedures and is improving the anti-aging parameters that we reach with this kind of procedures. Okay. The conclusion is that both studies with non-ablative fractional laser and with ablative fractional CO2 lasers, the application in these cases, the application of SCA 40% immediately after non-ablative or ablative fractional laser and in the following stages can accelerate the healing, reduce the adverse events, and enhance the procedure outcome with very good tolerance. Okay, and really is a valued tool for to use it after the procedure. In all of the cases, we obtain better results of the technique that we are using it, and think that is a very, very good results that we obtain using it. Is Cryptomphalus aspersa secretion 40% immediately after the procedure and during 1 week. We can obtain better results of all procedures that we can perform in the office. And we have experience published in this case with non-ablative fractional laser and ablative fractional laser, but we have experience with another procedures like microneedling, like peeling, or like IPL, using it, this secretion immediately after the procedures. And that's all. And thank you very much for this invitation and to participate in this symposium. Thank you very much.